Ladies and gentlemen, I want to thank you guys for coming out today. This is kind of an exciting event, so if you guys are catching all the sessions, please catch as many as you can. This is one of many presentations that we're seeing at all of these conferences, so I want to thank everybody for coming out. There's a lot of really good sessions today. Get down to the solution floor. I can't encourage you to do that more. For those of you who don't know me, my name is Chad Hodges. I'm the VP of Business Development for Enterprise Networking Solutions. We're a local IT consulting firm. And today we're going to be talking about mobile device strategy and how to develop that BYOD strategy for your organization. And our friends at Healthcare, Cruz, who's the Deputy Director and CIO for Healthcare, is here to talk about what they did and what worked for them. We're going to be also talking about how to drive down the costs, and so he'll go through a couple of different scenarios, share some real-world examples, and I think you'll find it very, very fun, and the feedback and the response to what his organization has seen very positive. So I encourage everybody to ask lots of questions. If you don't, I will. So I'm a bit of a heckler, and I'm okay with that, but I don't want to be the only one. So I encourage everybody to feel free to, like I said, ask lots of questions. Chris is a pretty dynamic guy, pretty dynamic personality, loves giving you the feedback. They also have some really exciting things going on at Healthcare, for those of you who don't know. They just released their IT strategic plan just about a month or two ago, and they also have an enterprise architecture plan that will be released here very shortly that's very exciting with regards to everything that's happening with the federal government and all the different legislative mandates that are coming down. So without further ado, I want to introduce Chris Cruz, and like I said, ask lots of questions. Thank you, everybody.
Thank you, Chad.
All right.
Thank you, everybody. Chad's a good spokesman. I think I'm going to hire him for public relations for the department. Anyway, moving forward, as Chad talked about, one of the things we're going to talk about today is really a real live business case scenario. When I became the Chief Information Officer at DHCS a little over 2 years ago, our Chief Deputy Director came up to me the first day on the job, and she had an Android. I have an iPhone, but she had an Android, and said, hey, I want to get my personal email on my phone. I want to give up my BlackBerry, and I want to turn this thing in. I've been told we can't do this. Can we really do this? So I turned to our information security officer, and they gave me 101 reasons why we can't, and I said that their job was to mitigate risk for the CIO and to help the organization be successful. So that was really true. So this business case is around a real-life scenario around that. So when we first looked at it, we looked at really what we were doing from that perspective. And so today it is going to be a real-life scenario on our business case study on what we have today, the implementable steps that we took, and how we're going to execute within those steps moving forward. So first of all, Department of Healthcare Services, our division, we currently support 9,000 to 10,000 staff at DHCS. We are also a shared service provider, many of you probably don't know. So we support Department of Public Health's infrastructure and email. We support the Office of the Patient Advocate, our Health and Human Services Agency, Office of Health Integrity and HIPAA Compliance, and we support Covered California. It's also known as the Health Benefits Exchange. So we're basically a shared service provider. We have a data center obviously there. It's comprised of 900 to 1,000 servers that we continually virtualize. So it's a real dynamic place in the organization as we move forward. So routinely we deal with PHI data and HIPAA data. That's really what our business case is. And why is that so important? Because everything that comes through is PHI and HIPAA data related. So a smartphone solution was a little bit tricky because a lot of folks use ActiveSync today and other components within those programs. We cannot, and our ISO has been really diligent in finding a solution. So we're going to talk to you a little bit today about what we came up with, what those items were, and how we have what we think is a containerized solution to move forward with PHI data. So I see the ISO in the audience, so I'll be politically correct. So obviously that was a big challenge. So in 2011, Governor Jerry Brown signed an executive order requiring all state agencies to reduce the number of state-issued cell phones by 50%. The cell phone reduction was expected to save the state more than $20 million. So many state employees, including DHCS executives, were then asked to give up their cell phones and BlackBerry devices and express a desire to use their own personal phone. And so that's when we started thinking, you know what, we need to put a solution in place that's containerized, that is part of a solid mobility management plan as we move forward. So what we were trying to do is eliminate the one-time cost of buying phones and also look at that case, because when folks were actually wanting to lose their personal phones, we decided that we could not give them a stipend. So they're paying their own monthly data management user fee for the phone. Some of these phones were costing the state $100 to $110 depending on the plan per month. So if you do the math over a period of time, that's a significant savings. Today we have over 160 people that are on our personal cell phone policy. They've given up their BlackBerry and they have their own personal phones. And we've been able to load a device on those personal phones that we'll talk to you about. And we think that that's resulted in about a $300,000 annual savings. It could be a little bit more, but we have a PY that's allocated to look at that savings as we move forward. If we didn't have a PY, that PY is supporting the basically containerized network server as we move forward. And so one of the things we're looking at is the DHCS reduced its mobile services by 60% to meet the governor's June 30th, 2011 deadline. And that was equivalent to nearly 200 to 300 mobile devices by offering, again, the users the opportunity to use their own personal smartphones and connect them by using FIPS-compliant good technology. So basically, DHCS began looking for a mobile device management solution that would allow our department employees to provide work-related mail without basically containing and keeping away their personal emails. So again, containerization means that DHCS can wipe the good client off someone's personal phone but not touch any of their personal information. And that was really important. We also got a legal opinion on that said that that was the right thing to do, that we didn't have responsibility or we didn't have authority to address any type of other personal information besides that containerized good client with that email technology. So that's what we talked about in terms of containerization. It places really an unbreachable partition between personal and business data and allows smartphones really to keep relative data that's required, secure, and encrypted separate from personal data. So those are the alternatives that we really looked at within this process moving forward. Biggest challenge that we faced, really in order for this pilot project to be successful, DHCS had to find a solution that allows users to have the same functionality as they have on their state-issued BlackBerry devices. And as we talked about, address the public health information concern. How did you overcome them? Obviously the user interface, much like a BlackBerry device, it's installed. Unlike most other mobility management applications, it has a native application on the device and it's installed, which can differ greatly from device to device. In other words, every user using a good application uses the same UI regardless of the application. Thank you. I just returned from vacation, so I'm feeling a little hot. 3 days laying on the beach. It's warm up here. So anyway, moving forward, that's how we overcame that particular process within that application. Before the introduction to Good, DHS was hosting a BlackBerry Enterprise server and providing mobile application support via our BlackBerry device users. And obviously we do that today. One of the things we're moving forward with is CES email. We're moving from Microsoft, we're moving to the cloud. And one of the ideas that we have at DHCS is actually to get rid of BlackBerries altogether and move towards iPhones and standardize on the iPhone device. But due to the governor's previous executive order issuance, we're holding off on that pattern right now. But we do believe from a cost efficiency perspective that that's the right way to pursue and the right option moving forward. Obviously, we're writing mobile applications on our iPhones and iPads now. It's cheaper not to maintain a BlackBerry Enterprise server in the cloud. And we can move forward and move off of that basically old version, because now BlackBerry's coming out with an Enterprise 10 version, and that's not compatible with the older versions of BlackBerry. So there are some advantages, obviously, both from a cost efficiency perspective and also from an operational perspective that we plan to pursue. And I think that's where you're seeing the savings, because right now we support 150 BlackBerries at about $372,000. And really what we want to do from a CIO and from a business case perspective is quantify this by cost. Because I think what's important here is you got to show cost efficiency in moving technology forward. If I'm going to make the business case that bringing in iPhones and new technology costs the state more money, they're not going to go for that. So the business case here was from a cost efficiency perspective and how we can save the state money and how we can move forward and proliferate these upcoming smartphones. So $372,000 was what it cost us today. And then again today, the cost dropped about $110,000. It's more like $150,000 based on where we're at today in terms of that savings from the BlackBerry switch to the Good Technology switch. And right now, the Good Technology services cost us like $6 a month to put the Good client on everybody's personal phone. The state does pay for that, but that's a huge savings based on $100 a month for that phone versus $6. So you're seeing a $94 return coming back to the state within that process. So it's a good business case to have as we move forward. We talked about the results. Let's see here, I'm going backwards. So we talked about the hosting of the BlackBerry. Let's see. Biggest challenges, DHCS had to find a solution, as we talked about, that addressed the state user BlackBerries. Using a common good had a common interface, a user interface, much like the BlackBerry devices, regardless of the devices that it installed on. So that was really important. So we talked about that. The alternatives that we considered really in our mobile device management tool, we looked at a lot of different alternatives, and as I mentioned, one of our biggest issues was the use of ActiveSync, that we saw a lot of the programs used ActiveSync technology on their mobile devices, and we couldn't use that. Again, because we're a PHI shop and we use HIPAA data, it was determined that ActiveSync had too many vulnerabilities within the technology. So we evaluated quite a few mobility management plans. Good was the only technology that we saw, again, that was containerized, that placed really an unbreachable partition between personal and business data. And we felt that that was really important within this process, because if you don't have ActiveSync, if you have issues, or if you have partitions and breaches, that's not good in your organization. And those are things that we try to stay away from a positive perspective. So as we move forward with our CS solution, we are going to continue to keep good technology as our mobility management solution because of those issues alone. Again, we're secure, it is containerized, and it's something that we can wipe off people's phones. So as we replace BlackBerries with smartphones, and we're going to keep good technology and load that on every one of our iPhones as well. Because again, we need to be vigilant about our information security, and we want to be sure that we're dotting the I's and crossing the T's. Every year about this time, CMS, who's our federal partner, comes to audit us, since they give us funding to make sure that we're in compliance with those federal statutes and regulations. So that's extremely important as we move forward. I think the biggest challenges that we faced probably on state-issued BlackBerry devices was obviously the PHI concern. I think that that was really big in terms of moving forward with this process. Again, we had to address that. And that was a big issue prior to looking at good, that we couldn't containerize phones. We couldn't keep that out of the particular area, so we had to stick with BlackBerries for the longest time. But again, I think the opportunity with the governor's executive order really to reduce our cell phone usage really came about this great idea and opportunity to look at what lied ahead. So we looked at the challenges that we had with our mobile phone processing and how we wanted to move forward and proliferate a new successful innovative deal. And I know today that also DMV and I believe FTB also use good technology as well. So the organizations that deal with PHI data understand that that is a solid mobility management device solution. So we talked about the common user interface. We talked about the results. Initial goals, obviously, in the enterprise pilot were meant, as everything that you do in life, you should probably start with a pilot. So we started with a pilot back in April of 2011. And obviously our executives for the Good Enterprise Program were basically selected. Obviously we haven't moved this down to rank and file employees yet because of the union issues that we find ourselves with, but we have met and conferred with the union on these issues, and they also think it's a great idea moving forward if executive staff or rank and file staff want to embrace BlackBerries, or excuse me, iPhones or Androids moving forward. So I think the business case is there to reach out to SEIU and some of the other unions in town to move forward with these smartphones, because I think they see the cost-benefit analysis that's put into this and how we want to move forward, that it's a win-win both for the employee and for the state. So basically, in terms of install, the install is really easy. We gave the executives installation procedures that we sent by email to them, and so they were able to log into their own system, log into their email, download the Good client, and within 10 to 15 minutes they were able to apply and install the Good client on their smartphone. That's how easy it is. In fact, today I think we have probably few issues with our Good technology. It's like it's a black box kind of running in the corner. We don't have to really manage it. People understand how to use it. It's up most of the time. I don't think we've had one issue with Good technology since I've been CIO in the 2.5 years we've had it in place. So it is dependable, I would say, at 99.9% of mean time. So very easy to install, very easy to proliferate, very easy to put on your phone, and also very easy to wipe. And that's the most important thing. So how we manage that process is we have a mobility management policy at the state. We have mobility management ISO regulations that each user must sign and acknowledge when using their own personal phone. So we have all the policies in place, so we're truly dotting the I's and crossing the T's as we move forward here. And it's quite a comprehensive plan. Also, too, if you lose your phone, you're responsible for your own personal phone. You've got to go down to Verizon, AT&T, or Sprint to replace your phone. We'll wipe the Good technology, so that's the secure part. So again, it puts the responsibility back on the user of the phone, and to date, we haven't had anybody use their phone or lose their phone. And I think that's really important because people are more responsible for their personal phones because they're paying the bill, right? So that's the big, plus that comes with it. The state wins and also the employee wins as well. So it's a win-win situation. As we talked about, we think it's the best mobility management project. As mentioned, again, DHCS is mandated to have all mobile devices encrypted due to stringent Health Insurance Portability and Accountability Act, which is of 1996. And it's one of the few mobility MDN products that offer Federal Information Processing Standards. That's called FIPS compliance for both encryption, which is a security requirement of DHCS. So FIPS compliance means, again, when CMS comes out to audit us, they say that we have FIPS compliance solutions in place. So they'll give us a passing grade, because if we don't have that compliance in place, we can be fined a lot of money, and we can have our delegation authority pulled for our federal dollars. So it's very important that we follow stringent processes and policies as we move forward. I think lessons learned and recommendations here is really, take a pilot. If you're looking at this closely, look at a pilot. Look at a subgroup of people to test this on, basically, if you want to move forward as with any solution. DHCS, we worked with AT&T, which is the good client, on a 9-month proof of concept, really to determine whether good was the appropriate mobility or mobile device management solution for the department. Basically, again, we had over 100 clients within this area. They consisted mostly of executive and management staff and IT professionals that were the super users of the mobile devices. So once we proved the concept, we proved that it worked, we proved that it functioned rather seamlessly in terms of the transition and moving, we decided to make it a permanent offering within our organization. And like I said, today we have over 160 folks that use their own personal phone and bring those to work. And again, that's significant because there's cost savings approach with that, and it's a cost savings transition for people. So again, what our solution is moving forward with the remaining 350 BlackBerries that we have in the department, our goal really is to transition those to iPhones once we can get CTA and Governor's Office approval in which to do so. And we have the cost-benefit analysis that we can also provide that says that's the best move for California. And it will result in cost efficiencies and provide more effectiveness in terms of our solutions. So some of the other things that we're doing with our iPhones now in our BYOD program is we're now writing mobile applications. And so today we have the first ever healthcare quality report card. So if you go down actually to the showcase form, you can see that quality report card. It's now on an iPad and an iPhone. It will give you HMO and PPO scorecards and grades. You can take a look at your doctors on how they score out, questions you might want to ask your personal physician. And the reason is we want to appeal more to our stakeholders and constituents now as we move forward. We think it's really important that most Californians now have smartphones or other devices, and they want information instantly. And they can pull this information up on their phones now and move forward. So that's why we're moving towards this type of platform for BlackBerries and support. We hope that this is the first of many healthcare mobile applications that you can download and use, because we understand that we need to address and make information more readily accessible for our stakeholders and constituents. And that's what's really important. So also too, as mentioned, I mentioned the ISO. It is important that you get your ISO involved early and often. And I have to say I'm very fortunate that I have one of the better ISOs and teams in the state. So they make my job easier, but they're also there to ensure that we have the necessary checks and balances. As Chad talked about, I'm kind of an innovative and dynamic guy, so sometimes I get overly enthusiastic about things. So it's nice to have somebody that's in the middle to ensure that they put checks and balances around you. So while I don't always agree with my ISO, I have a lot of respect and credibility for the job that they do. They keep me out of trouble. What critical success factors? What did we learn? I think the important thing of anything in life, you always look at lessons learned and recommendations and the things that you do, and I think that that's really important. Obviously, the first thing is you got to get executive buy-in for the things that you do. You got to understand that executive sponsorship is very important, and that you get the directorate or your chief deputy's buy-in, or even agency secretary, depending on your reporting relationships. Ensure security and privacy staff participate in analysis and address risks and issues. Again, this is very important in the things that we do here. Require that employees participate in a bring your own device have signed and agreed to the policy and remote access agreements. You got to have documentation in place. You should also have your legal people look at this as well, even though this is not documented here. Get OLS or your Office of Legal Services approval for things you do, because in some departments it may vary in terms of how interpretation of legal policy is provided, so that's very important. Also too, remote access management capabilities, again, to wipe the good client off employees' personal phones in case it's lost or stolen. or need to be revoked, that's also important in terms of an actionable process. So if you have an employee that's leaving because of a personnel action, then you can wipe their phone remotely, whether it's their personal phone or not. That's also very important to protect your department's interests. All right. Well, thank you very much. I appreciate it.